My name is Jerry Nelson. I'm 49 years old. I'm from Bradenton, Florida. Born and raised. I'm a UPS delivery guy. I was a smoker. I smoked cigarettes for a number of years. Um, just wasn't really too concerned about the health of my body. And in the recent years, the last 4 or 5 years, I've been more concerned about it. And I was noticing that it was pretty rough for me to get along. It was just in my foot, in my toes. I thought I've heard it at work or something because it got to the point where it swelled up really big and it turned colors and it was very painful. I couldn't walk, I couldn't sleep, I couldn't lay down, I couldn't sit down for any period of time without it being painful and me having to readjust and stand up. I went to several doctors. I went to my primary care physician. I went to a workman's comp doctor. I went to several doctors and nobody ever said it was anything vascular. They would give me antibiotics saying it was an infection, or they gave me a walking boot saying I broke my toe and then they couldn't tell where the break was. But every doctor I saw said, how are you going to work? And it's just, I guess I have a family and I have a family to take care of, so I have to go to work. But I shouldn't have been. I worked for 3-4 weeks on my foot and I shouldn't have been, but I didn't have a choice. I was out of work for 6 weeks. Went back to work for a couple weeks and noticed that it started happening in the toe next to mine. So at that point, I was really frustrated and I wanted answers. The last time I went to urgent care, he didn't even look at me. He looked at my leg and he said, "That's vascular. You need to seek help." He actually set me up with Dr. Begg, gave me all his information, and I made an appointment to see him.
Unfortunately, he went a very long time before anything was really done for him. And also, just lack of education in the patient space. They look at it and they say, okay, this is my job, this is what I do, and maybe this is just pain related to my job, etc. And so things are usually delayed or not taken care of. And that's how they present a little bit later on in their disease process. My name is Iftikhar Beg. I'm the director of the cardiac cath lab here at Blake Hospital. My focus is limb salvage. My practice focuses on limb salvage and peripheral vascular disease. We do have approximately 1,500 to 2,000 patients on the vascular intervention side that we do see yearly. Peripheral vascular disease can account for multiple different types of issues. Patients come in with lower extremity pain while walking, pain at rest, wounds that don't heal, etc. But a lot of times this goes unnoticed because we have a lot of residual that our body can handle, and as a result, patients kind of think, oh, this may be just my musculoskeletal type diseases. Peripheral vascular disease accounts for a very large portion of cardiovascular health issues in the United States, and has progressed increasingly. It increases with age, increases with other risk factors such as tobacco, diabetes, cholesterolemia, etc. So for him, after we diagnosed he had severe anterior tibial artery disease, once we found his disease, I proceeded with an angiography and intervention. Angiography is using IV dye or contrast to visualize the arteries from within. And we do that using X-ray equipment, and we do that in the setting of a cardiac cath lab. So we go in through an IV, and through that IV, we then advance different catheters and wires to the area of concern. We did not have to put a stent in. We were able to perform atherectomy, which is plaque removal. We did that in multiple areas. We also did multiple rounds of angioplasty or ballooning of the area, after which the lesion looked fairly resolved, and there was no trauma to the vessel, which would require stenting, or residual stenosis, which would require stenting. So we were happy with our atherectomy and angioplasty.
Recovery was good. I had surgery on a Monday. They released me from the hospital on Tuesday. I can definitely tell that there's definite blood flow within my leg and my foot, just for the simple fact that the swelling in my foot usually takes 6-8 weeks to heal. And since the surgery, it's already almost healed. I attribute that to proper blood flow in my leg and my foot. Honestly, I just wanted to work. I just want to work and take care of my family. Pain free, of course. I can just go on, continue to, to work hard and provide for my family and enjoy life, like really enjoy life. Definitely talk to your primary care physician. Don't be bashful. Tell them, exactly what's going on with you and, you know, demand relief, not only relief, but demand knowledge of the situation as to why it's happening.
Starting the conversation around PAD with your doctor is an important first step in your PAD journey. Visit padpulse.org to learn more and access additional resources.